I'm one of the speakers in the conference today, and I spoke to the men. I was requested at the HIV/AIDS administration. I am an HIV/AIDS activist. I've been doing this for many, many years in Washington, D.C. I had a burden for the families that were infected with HIV and AIDS. Of course, I'm a minister, and I preached a lot of funerals. I presided a lot of funerals of people who had loved ones who expired as a direct result of HIV and AIDS. Personally, I'm affected being a part of the community. If you live in a community where there is a social epidemic such as HIV and AIDS, you see, like I said, people suffering. You see people just melting as a direct result of this disease. When I say stigma, I mean associated with what the quote-unquote powers to be associate disease with. The disease is still associated with being gay, drug use, and other social ills. So it's like, you know, HIV is just another one of those things compounded upon another one of those things, which makes you feel not good about who you are, which makes you feel maybe less than who you should feel that you are. I certainly do think that sex could be one of those stigma-related issues. My approach is a very comprehensive approach, and while I think that sex is really important, I think knowing who you are and understanding yourself from a spiritual perspective is much more than the sexual piece. Because if you really know who you are, you would know that you are greater than exposing yourself to a lot of the social ills, which is having unprotected sex and being involved in illicit lifestyles. So I think it has to be more comprehensive. Health education, sex education is one of those components, but I think it has to be more important. I think that's why people use drugs. I think that's why people get involved in other illicit behaviors, because you have to really understand who you are from a spiritual perspective, and a lot of us don't quite get that. We have an HIV/AIDS prevention program. We also offer food bank services. We provide HIV/AIDS prevention education. We go out a comprehensive DEBI, a diffusion evidence-based intervention, which is approved by CDC. And we go out to various community-based organizations, and we provide on-site services. We provide HIV testing in collaboration with Blair Underwood, Family Medical Counseling Services, and other organizations that are collaborative partners. But we really minister. Our goal is to bring people in to minister to their psyche, to their souls, to understand why you do what you do. Currently, we are looking at an evaluation tool that will help us at least begin to track behaviors as it relates to behavior modification. At this point, we're developing a tool, and that's really important to try to track the people that you work with. We can only base that on what information we're getting from the clients. You know, what the clients said they participated in when they first start to receive the services, watch the behavior to determine if the behavior was modified, and if it was, why, and if not, why. I think that is a critical piece with the public access television channels and with other forms of community with community resources. I think that at this point, what we're trying to do, of course, at this point we're not there, but we are moving towards advertisement, public access television. That's sort of one medium as it relates to getting our information to the public. We are very young as it relates to, you know, what it is that we do in the community. So we're moving towards that. But I think the media is critical because, you know, the media set the stage, set the tone. Whatever the media says, then some of us tend to buy into that. So if we're going to reverse that, we have to use the same monster that is used to say, well, this is what happens, this is how it happens, and we have to say, no, this is the truth. and we'll use that same monster to tell the truth, or to at least give our plight on what our focus or what our position is on HIV and AIDS, particularly as it relates to African American people.